Hi, hello everyone. This is PM Gayatri, Assistant Professor from Vale Nursing College. Now I am here to discuss about diarrhea in children's. So now summer season also started. Many children will get affected by the diarrhea because of the high temperature. Food will get spoiled easily in this season, so we can observe bacterial growth in the food. So whoever children they are taking the contaminated food or contaminated water, they will affected by the diarrhea. So now we can see the definition. Here, the definition is defined as the passage of 3 or more loose or watery stools per day or more frequent stool than normal for the individual. So, who are all the children's they're passing watery stools more than the 3 times per day, then we called as a diarrhea. So, we can see here causes like a rotavirus, Escherichia coli, Salmonella. So, these three are the main causes for diarrhea. So these Escherichia coli and Salmonella, these two are the bacteria, the most common cause in this summer season. So this rotavirus is the most common cause in rainy season. So these three are the main cause for diarrhea in children's. Next we can see the signs and symptoms like a frequent loose or watery stools, abdominal pain, urgency for stools, fever, weakness, loss of appetite. These signs and symptoms we can see in the children who are all affected by the diarrhea. And next, investigations like a stool examination, blood test, blood culture, urine analysis. So these four are the investigations we can find the cause for diarrhea. So through these examinations we can find the cause, and then according to that we can give the good treatment for the diarrhea. And then management. Here management for diarrhea, the most important is oral rehydration therapy, because who are all affected by diarrhea, they will get dehydration. So for rehydration we have to give the oral rehydration therapy here. So it is a very important management in the diarrhea. Next one is the intravenous fluid and zinc supplementation and nutritional management. So here zinc supplementation is a very important when we are giving paid with the oral rehydration therapy, because when we are giving zinc supplementation with the oral rehydration therapy, so it will helpful for the to reduce the duration of diarrhea, severity of diarrhea, and future incidence of diarrhea also. So whenever we are giving zinc supplementation, we have to give with oral rehydration therapy. And next one is the nutritional management. This nutritional management also important to replace the nutrients in the children's body. So these are all the management for diarrhea. And then nursing management like a administer ORS after each stool, and we have to maintain strict intake and output chart, means how much quantity they are intaking through orally, through IVF or through ORS, and how much quantity out coming out, means how they are excreting through urination, through stools, and maybe vomitings. Okay, these and all we have to record in the intake and output chart. And then encouraging the feeding. So we have to encourage the feed for the baby or children, and then continue breastfeeding. So who are all mothers they giving breastfeeding to the children, so we have to encourage the mother to give the breastfeeding continuously. And then provide small frequent meals. So these babies or children's will have loss of appetite. So whenever they have loss of appetite, they won't get sufficient nutrient to their body, so that we have to provide small frequent meals for the children. So these are all the nursing management we can do in the diarrhea disorder. So this is a nursing management for diarrhea in children's. So we have seen definition and causes and signs and symptoms and investigations and management with nursing management also. So this about diarrhea and its management. So with this this session is over. Okay, then thank you to everyone.